Hi, welcome to Fast Facts with Dr. Tan. So today we're going to talk about chronic prostatitis, also known as chronic pelvic pain syndrome. For those of you who have been unfortunate enough to suffer from it before, you know that it's a horrible thing to have. It causes a lot of pain, a lot of discomfort. It's usually very chronic, very intractable, and doctors have tried all sorts of treatments for it with varying success. So today we're going to talk about this paper that discusses yet another potential treatment for chronic pelvic pain syndrome. The paper is entitled Tadalafil is sufficiently effective for severe chronic prostatitis, chronic pelvic pain syndrome in patients with benign prostatic hyperplasia. So those of you who are familiar with Tadalafil, is actually goes by its brand name of Cialis. So Cialis has been used in the treatment of chronic pelvic pain syndrome. What it does is it increases the perfusion and the oxygen delivery to the pelvis, reduces inflammation, and can improve the symptoms quite dramatically. Obviously, just like most treatments for chronic pelvic pain, it is not a golden bullet, but just one of the multiple treatment options that we have. So we use various different medications, from nerve stabilizers to tadalafil to anti-inflammatories, and we also use things like low-intensity shockwave therapy for prostatitis. Now, the lesson learned here really is that there's no one thing to treat prostatitis. You really need to have a conversation with your doctor. Find out which are the symptoms that's most troubling you, and most of the time it's a little bit of trial and error before we actually find which therapy will work. And although we aim for a long-term cure, sometimes it is more a long-term management. So if you do suffer from the symptoms of chronic prostatitis, go speak to your doctor, talk to him about tadalafil. It may be for you, it may be not, and obviously explore all the other therapeutic options with him. This is Dr. Tan signing off.